Yeah. So hello to everyone who joined. We are starting the last session of our Medical Wonders Medicine Week for 2022 from August 22nd through August 27th. Now let's go over some reminders. Remember that you need to attend 2 or more calls this week or view the recording on the YouTube. The instructions for the rest of the week is that you will receive 2 hours per call with the medical professional for the Zoom calls. We will also be marking down any attendance, and we will record the meeting. So in order to verify the attendance, you must submit a quick paragraph on what the calls talked about in the Google Classroom. If you do not join this classroom, you will not receive your hours. You must email medical.wonders@gmail.com should you have any inquiries. Your paragraph must be in 5 to 6 sentences and have specific detail. You must write 1 paragraph per phone call. In the Google Classroom, you will have different assignments for the call, so ensure that you submit each one under the right call. Please put your phone name on the paragraph, and once you submit that, you can receive a certificate with your hours and full name. It may take several days for you to get your certificate, so please be patient. In order to list this on your college application or resume, you can write about how you learn about different career paths, professions, and college plans. You can learn about advice from medical professionals and students about their study habits. If you attend all the calls, you will receive around 8 to 10 hours of shadowing experience. So, what is Medical Wonders? We are a student-led nonprofit organization that educates and advises students on different medical procedures, careers, discoveries, devices, and more. We cover topics all around the medical field. We cover 4 executive teams, including researchers, editors, communicators, and graphic designers. We include 10 college mentors and 50 tutors, and we boast over 200 members. Through our many events and initiatives, we have reached over 300 people and have created partnerships with other nonprofits. What is Medicine Week? So every day this past week, we had a medical professional or student go on a Zoom call with us for an hour and gave a presentation on their introductions, studies, life, and a Q&A session at the end. To check out our full panel board, please go look at our Instagram for the full descriptions on each doctor or student. Our Instagram handle is medical.wonders. You can also check our YouTube out at Medical Wonders, just into the YouTube channel. Here you will find recordings of past webinars and our Medical Week recording. You can also follow us on TikTok and Instagram for more updates. Our Instagram is medical.wonders and our TikTok is medical.wonders as well. Thank you. If you have any questions you think of later, you can find us at the Medical Wonders Instagram and the Medical Wonders Gmail.
Okay, now we will be introducing Dr. Corradetti, who is our guest speaker. So Dr. Corradetti, if you want to share your screen and also mute yourself, and the floor is yours.
Sure, thank you. Okay, can you see my screen? Can you hear me?
Yep.
Yep, we can see.
Perfect. Thank you for having me, and thank you for caring so much about education and mentoring and like inspiring like the new generations of doctors. I really appreciate that, and I'm really passionate about mentoring because I come from a background where I didn't get so much mentoring, and I didn't get any mentoring in high school, in medical school, residency. I just learned about mentoring when I came to US. So this is just great. And I would like to empower the young medical students or just college students, high schoolers, to because mentoring will really change their career. And I really think that a good mentor will completely change your career. When you think about a mentor, think about that you should compare your professional life to your personal life. In your personal life, you had mentors. You had your parents or community or friends or whoever raised you. And that was so important for you to grow up and to mature. Same thing in your professional career. It is so important to have a guide, to have someone who is gonna tell you what is the best way to go. It doesn't mean that a mentor will completely change the pathway, or like the mentor is not gonna be the person who will do the work on your behalf, but it will show you the best way to go. So probably if you're a successful human being, you will always be a successful human being with and without a mentor. The difference is that with a mentor, you get to your goals faster. And I like to remind everybody that we all have a different story. We have a different background. We come from a different states, countries. We were raised in a different way. So this is very important to remember, that our story is important, because sometimes I hear medical students or pre-meds or like high schoolers so focused on grades, so focused on that single exam, so focused on their CV and personal statement. And I see many times CVs and personal statements, they're made like with a cookie cutter. That is not the answer to success. Not necessarily with a perfect score, perfect CV, you will have success. So always remember your story. And whenever people will tell you that because of your story, you are not gonna achieve your goals, just forget about them. Don't listen to them. Listen to your heart, listen to your dreams, to your goals, and you'll be fine. So I am a dreamer, and I always trust my dreams. And it is what I always tell my mentees. Trust your dreams, trust your story, trust your journey. The journey is the most important part, because, you know, once you get to your goal, you just enjoy the view. The most important part is the journey, is when you have to get there. That it's when you study, but you don't want to. It's when you struggle, but you stay there because you really believe that your dream is important. And if you don't trust your dreams, nobody else will trust your dreams for you. So you have to be very committed to your dreams. So this said, I'm gonna, of course, this is my favorite quote: to have a dream coming true, you have to have a dream. And I like the comparison, comparing the medical career to planning a vacation, for example. You have to know, like, the most important things are you have to know where you start from and where you want to go, because it's very hard to plan like a travel journey or like a vacation if you don't know where you want to go, or if you don't know where you're coming from. So just keep this in mind and never forget where you're coming from. In fact, this said, I would like to introduce myself, and I'm not I was not born in US, so my pathway, my path is a little bit different from many other doctors here. I'm an IMG, international medical graduate. I was born and raised in Italy. I went to school, medical school there. I went to residency there, and I wanted to have an experience abroad, and I did an international fellowship in pediatric ophthalmology in LA, and that literally changed my life, so that I decided to stay, and I did a few other medical retina fellowships. Of course, my path is different from the common path for US graduate. Is like bumpy, harder, longer, but it is worth it. The most important things I learned during my time here was the importance of mentorship. Mentorship is essential for your success, because you can learn from your mentor's mistakes, and you can get to your goal so much faster. So what is a mentor exactly? I see a mentor as that professional, all mentors are all those professional figures, in this case, doctors, researchers, that are successful and passionate. It is important that your mentor is successful and passionate at the same time, because you want to learn from your mentor knowledge, but you also want to learn how to keep the enthusiasm high. And they are so passionate and successful in whatever they do, and are willing to set aside time to read, to teach, to empower, to support you, to inspire you, to give you, to tell you their story, to tell you their mistakes, so you're not gonna make the same mistakes, to make you a better person, a better mentee or trainee, and to get you wherever you want to be. So, of course, a very good mentor, it is the most powerful tool you can get during your medical career. And again, the good mentor is not the one who only makes you a better doctor, a perfect bucket of knowledge, but is the one who makes you a ethical doctor, a better person. So I am very lucky, because I found good mentors and I treasure them. My success it happened because of them. And this is I wanted to point this out to you, for whoever is interested in ophthalmology. There is a group of very empowering people, and this group is called Young MD Connect, that put together a mentoring platform for aspiring ophthalmologists, to let students and residents and trainees to build their network, to meet the people, to listen their stories, because sometimes it is not easy to find a mentor. It is not easy, or maybe for the type of personality you have, it is not easy for you to reach out to people. So this is a good opportunity, but of course it's focused in ophthalmology, so not everybody can be interested in. Again, mentors are not the ones who are doing the hard work for you. They're gonna show how to work hard. They're gonna empower you by example to help you to get there. I highlight this because very often medical students or trainees think that your teachers have to be mentors. Not everybody is built to be a good mentor. So I would always be very grateful if you find one. And I like to be humble. I think being humble, it is a very good personality trait. Happens we live in a very fast world, so very often we think that we need to be expert right away. We don't think that everybody started as beginners. And so it doesn't really matter at the beginning of our career, at the beginning of your training, to be humble. Actually, you have to be humble, because being humble is the only way you have to become an expert. If you're humble, you ask yourself more questions. You're willing to learn more, to read more, to document yourself more, to gain more experiences. So I think this is very important. At the beginning of your career, you cannot be an expert. But it doesn't mean that you're not valuable. It just means that you're just a trainee. It's just the beginning of your journey. So walk humbly always and be grateful. Another topic about medical training that I think it is important to talk about is the life-work balance. In this case, like sleep balance. First of all, when you think about to wanting to become a doctor, a physician, or a researcher, and you wanted to be in the medical field, ask yourself if this is really your call, if really it is what you want. Because the journey is pretty long, can be stressful, so you have to be motivated enough to do it. And the best way to go is to shadow other doctors, to shadow other physicians or researchers at any level, because like being a doctor is not like like scrolling an Instagram page. Like the doctor's life is not always so glamorous. Training is long, and also work can be stressful. Okay, you are requested to work at a high pace, and like you have to put your patient first all the time, even when your life is giving you hard time. At the same time, it is not an easy journey, but it is a wonderful journey, only if you like it. So the shadow people, shadow doctors, shadow professional, and don't be afraid to reach out to multiple doctors, to multiple medical professionals. Don't be afraid to get to get rejections. Everybody had rejections in their life, but it is important that you experience that life. You make that experience before making a life-changing decision. And also remember that the medical career, it is not a sprint, it's a marathon. Training can be long as 15, 20 years. And so it doesn't really make sense to get burned out during the first few years of your medical training. So go step by step, very slowly, and think about your mental health. Surround yourself by a very good group of friends or supporters, community. Think about your mental health. So fill up your day with physical activity, things you like to do, vacation, or going shopping, or like eating healthy, or spend time with people. Don't focus only on the medical training, because you need a support system to survive. And I think it's very important. And this is like a beautiful journey, so mainly enjoy the journey. I am a retina specialist, but I also work in clinical research. And I think that clinical research, it is another way to get involved in the medical world. I think it is very important because you not only impact one person with clinical research, you will impact a lot of more people. So it's very powerful to do research, but you have to know how to do research ethically. And I always think that it is better to get involved into research sooner than later. And I didn't have the opportunity to get involved in research at the beginning of my training, but when I came to US, I experienced clinical research, and I really love that part. I really love that part of my job. And it is important for a pre-med, for medical students, not only to get publications, because we all like to write papers and present our research, but I think the most important part of doing research as a medical pre-med is to learn more about that world, to become a better student, to become more curious, to discover new areas, to improve your knowledge, to learn what you like and what you don't like, to learn ethics. And those are very, very super important if you want to be a doctor one day. And so just to conclude, I think that work hard, be persistent, perseverant, humble, and also have faith. Trust your journey, believe in your dreams, and everything is gonna be fine. So if you have any questions on how to, how to get involved in research, how to reach out to mentors, how to find mentors, feel free to reach out to me. You can just message me on Instagram, and I am happy to help you as much as I can. Because I was a medical trainee without mentoring, and I'm really passionate to change that part. Thank you.
So if anyone has any questions, please go put them into the chat or privately message me or Dr. Corradetti. But I think for now, if we don't have any other questions, we'll just go over a couple of general questions in order to get the ball rolling. So what type of medical specialty? Oh, wait, here. We actually do have a question from Nafisa Promi. So she asked in the chat, how do you find a mentor, and how do you find a mentor, especially when you're in high school?
So I think the most important thing before even like looking for a mentor is to ask you questions, to ask yourself what you want to be, where you want to go, where you see yourself like in 1 year, in 4 years, in 5 years. Because to find a mentor, you have to have a dream, you have to have something, a goal that you want to accomplish. And then based on that, you can go towards one direction or the others. In high school, what I always recommend, for example, it is if you don't have a teacher that can be a mentor within the school, I always recommend to volunteer for based on your on your goals, on your dreams, on what you want, on your mission, on what you like. There are different opportunities. But with volunteering, you get to build your network. If you already know that, for example, you're interested in the medical, to become a doctor, for example, I would target those opportunities that will let you get in contact with doctors, with residents, with fellows, but not with the purpose to shadow them and to get right away into the research, to get publication, those things. No, I would like shadow them to understand if really what they do, it is what you like to do. And I think this is very, very important. And I think the earlier like you understand which way you want to go, the better it is for you, because you will get there like faster. So, but I also would recommend to do multiple experiences. Don't focus only in on one opportunity. Try to diversify like your experiences. Try to, I don't know, like to volunteer for, I'm just saying something like an eye doctor, or like apply to go abroad with global medicine, or this will let you understand better yourself as well, how you interact with people, your type of personality. I think this is very important for high schooler. I also know that there are some hospitals, for example, who have high school program, shadowing programs for high school, for high schoolers. Or let's say you don't know if you want to become a doctor, you like medical training, or you like to be in the health system, but you don't know if you want to become a doctor. You can also explore other opportunity. Like, for example, there are many pharma industries who have like summer training programs for high schoolers. That is something that it is important to explore as well.
Thank you for that explanation. Do we have any other questions for our host? So we have one. So what type of medical are you in?
Sorry, couldn't hear very well. You broke up.
So yeah, that's okay. I'll repeat myself. So what is your daily routine as a, say, eye doctor?
Well, I do both research and clinical care. So, like as an eye doctor, it's very generic questions, because in the sense that it depends. Like in ophthalmology, we have a lot of subspecialties. So depending on what you do, what is your subspecialty, your day will change. So there are some subspecialty that are more like surgical focused. So they may spend a lot of time in the operating room, and then some time like with patient care, so like seeing the patients. In my case, I do medical retina, so I do patient care, like in a clinic setting, and I do a lot of research, and I do work with imaging. So we have a lab where we basically analyze images, and during my research days, I focus mainly to review the literature, what has been published already, and to design new studies, and to analyze data, to analyze images, to run statistical analysis. It's every day is different from the other. It's not very repetitive.
Oh yeah, so what type of volunteering did you do maybe throughout college?
Well, as I said, when I was in Italy at that time, so I did not do any volunteering because we didn't have a good like mentoring system, and what we were requested to do was just have knowledge. Was just like basically studying. So I spent my college years just studying medical stuff, basically. It is when I came here in US that I understood the importance of, you know, like building a network, finding a mentor. So I did volunteer with, you know, different foundations. That there are many foundations actually across the United States, and you can volunteer with. After pandemic, it is even better because many of those foundations have developed like virtual programs and in-person programs. So it is even like if you want to understand, for example, if global health is something that you want to explore, there are different programs across worldwide offering for trainees, medical students, pre-meds, or high schoolers, virtual involvement. So at least you have an idea what they do, how their organization works, and all those things.
Yeah, so what did you do for like self-care, especially when you had exams? Do you have anything you like to do in order to just, you know, take care of yourself, especially during times where you have to study a lot?
Well, I always try to like not focus only on studying. Like, first of all, I think there are some times, like, you know, when the exam is coming up, of course you have to study more, you have to focus more. So it is normal to spend most of your day studying. I would always recommend to follow a healthy diet and to, you know, to do exercises. But during the times where you don't have an exam or test very close, if you're in medical school, you still need to study like every day. But don't forget to fill your day with, you know, calling your friends or doing something that it is different from studying. That will restore you, will give more energy. And at the same time, it is very important to have a support system, because during the hard times, you won't feel alone. And that is very important. Because with a support system, you see others going through your same struggles and you feel supported, you feel empowered. If you go through it like by yourself, sometimes you feel like you're the only one living the struggle, and this is not true. It is hard for everybody, but it is totally doable.
Thank you. So we have Nafisa who has asked another question as well. So she asked, what was the hardest part of getting into medical school, and what advice would you give?
The hardest part to get to medical school, well, I think the hardest part for everybody, is like that you want to get into medical school and you don't know if you're gonna get into. So I think that is the hardest part. And it is hard because partially is out of your control, because there are so many variables that you cannot control. So here, I think it's I actually did my medical school in Europe, and there it is very hard because you have one chance, one day. They don't judge your CV. It's just a test. You take the test, either you're in or you're out. Here, I think it is actually not saying easier, but it is better because you actually have the opportunity to show your face, to show the person you are, to you know, to speak with your future mentors, probably, to give them an explanation of the person you are, why you want to get in medical school. So and I think overall, even if you don't get the first time and you really want to get into, I wouldn't give up. I would do everything in my power to improve my CV, to increase my chances, to be appreciated. And you know, there are many ways to improve your CV. There are many ways to be a successful applicant. And this changes a little bit from school to schools, because there are some schools, for example, who are more academic based. Other schools are more like less academic based. So it is important, I think, in my opinion, to have a mix of experiences. So you really can sell yourself pretty well. And I always like to tell like mentees and trainees that the school will select the person, won't select the CV. So this is very important to keep in mind.
Okay, thank you so much, everyone, for asking questions, and thank you, Dr. Corradetti, for answering. I think now we're going to hand it over to Sandra in order to just quickly wrap up this call and say any parting remarks.
Okay, thank you. So if anyone has any questions, Dr. Corradetti, can you just drop your email and Instagram maybe in the chat? So anyone can reach out to her. We'll also have all of her stuff linked below. And yeah, I just wanted to say thank you so much, Dr. Corradetti, for coming on and talking more about mentorship and all of that. I know a lot of high schoolers here are watching and they can get a head start on this, so I really appreciate that. And as for like closing remarks, this is the last session with medicine week, so make sure you guys go onto the Google Classroom, fill out all of your assignments. Everything will be due September 5th, 11:59 p.m. Eastern. And if you have friends that want to sign up, signups will be closed on August 29th, so this upcoming Monday, 11:59 p.m. So yeah, thank you so much, Dr. Corradetti, for coming on, and everyone else, you guys are free to go.
Thank you very much.
Thank you, everyone.
To me.
Yeah, Dr. Corradetti, you're free to go, but thank you so much for coming on, and we will put this recording out, so let me know if you want the recording or anything like that.
Okay, thank you.
Bye.